My name is Kayla Cox, Kayla Cox, and my client is Meg Eckhart, Megeckart, and she is 44 years old. Her differential diagnosis is methamphetamine use disorder. And for the primary diagnostic features, I have one, a person with this disorder exhibits a tolerance to methamphetamine, and when methamphetamine is no longer used, they experience withdrawal. Now for Meg's story. She is a divorced woman with 2 children. Her children do not live with her because her ex-husband was given primary custody of them. Her husband is trying to overturn her visitation privileges because she used methamphetamine when the children were with her during her last visit. Her visitation has been suspended pending the results of a court-ordered psychological evaluation. Meg started using crystal meth approximately 5 years ago to lighten her mood and deal with her depression. Her husband seemed to enjoy her company more when she was high, but he didn't know that she was under the influence of the drug. Eventually, she needed more and more to get the same high. She knew that she had developed a tolerance for the drug, so she stopped using for a period of time. She experiences withdrawal when she doesn't use, and this increases her depression, so she has created a catch-22 for herself. She started using again during her divorce. Meg is now unemployed. She was fired from her job as a nurse after her drug tests came back positive for methamphetamine. She was suspended and required to enter a drug rehabilitation program, but she refused. Currently, Meg appears very depressed. She now has thoughts of taking her life. She has lost 25 pounds in the last 6 months, but doesn't know if it's from her methamphetamine use or decreased appetite from the depression. She expresses a sense of hopelessness about her life, especially since the divorce. She reports sleeping 10 to 12 hours each night and sometimes skips personal hygiene and getting dressed. Despite all this, she wants her children back. Now for the multi-axial diagnosis. Axis 1 is methamphetamine use disorder. Axis 2 is none. Axis 3 is drug test positive for methamphetamine. Axis 4 is recent divorce, loss of custody of children, and fired from her job. Axis 5 is a GAF score of 44. There are 2 theoretical perspectives that relate to this disorder. First, the biological perspective. The client may have a genetic predisposition for this disorder. Dopamine is secreted when the drug is used, causing overstimulation of the brain reward pathway. The brain adapts by producing less dopamine or by reducing the number of dopamine receptors in the pathway. This causes the abuser to increase substance usage to get the same level of pleasure. The next is the behavioral perspective. The client's drug use may be due to the faulty learning experience of operant conditioning. The pleasant effects of the high positively reinforces drug use. The use of drugs is also negatively reinforced because it allows her to avoid dealing with stressors or painful issues. For example, the divorce and loss of children. That concludes my presentation.